Do you need to take a vitamin D supplement? A recent study shows that vitamin D supplementation does not prevent fractures in middle-aged and older adults. Joining us now with more about vitamin D controversy is registered dietitian Brooke Bullock. Good morning, Brooke.
Good morning, Chantal.
What does this study look like, and talking about vitamin D this morning?
Yeah, so this study was actually published online in the New England Journal of Medicine on July 27th, and it followed 26,000 relatively healthy U.S. adults over the age of 50 years of age for about 5 years. What they found is that supplementing with 2,000 international units per day did not reduce overall fractures, non-vertebral fractures, and hip fractures. And this actually does coincide with other studies showing that vitamin D doesn't actually support fracture risk.
Okay, does this mean we shouldn't take a vitamin D supplement?
That's a great question. After this study came out, there were all kinds of headlines that came along with it. One that even went so far to say, stop taking vitamin D already. So today I'm actually presenting 4 key considerations before you make any, that I think are really important to consider before making any decisions around this. The first is that vitamin D plays a very important role in the body, whether or not it prevents fractures. So vitamin D is needed for maximum calcium and phosphorus absorption to enable that bone strength. Vitamin D also helps to prevent rickets in children and osteomalacia in adults, which is the softening of the bones. And finally, vitamin D has other roles like immune function, cell growth, and glucose metabolism.
Okay, wow.
Number 2, vitamin D, we have a recommended dietary allowance. This is from the National Institute of Health. They recommend ages 1 to 70 years of age consume 600 international units of vitamin D per day. So there aren't a lot of food sources that help us get there. We're talking a couple IUs in eggs, salmon and sardines, plant-based fortified beverages, cow's milk, and fortified margarine. So there's not a lot of sources. Salmon has probably the most at anywhere from 250 to 600 IUs per 3-ounce serving. However, a majority of my clients are eating salmon maybe 2 or 3 times a month. So we're certainly not getting enough in our diet. Number 3 is that while we can make vitamin D in the skin, it's very influential. It's influenced by a number of factors. So the time of year, cloud cover, sunscreen use, and how dark your skin is. So it's not necessarily the most reliable source. Vitamin D is also influenced by our exposure to sunlight. So living in a Nordic community, a Nordic country like Canada, definitely reduces our exposure to the radiation in order to convert that UV into vitamin D in the skin. And finally, we need to consider who is at risk for vitamin D deficiency. So this is breastfed infants, older adults, people who are homebound, and again, that sun exposure, so living in the Nordic countries, as well as people with chronic conditions like irritable bowel disease, or inflammatory bowel disease rather, celiac disease, liver disease, and people who have undergone gastric bypass surgery. So there's so much to consider.
Okay, well, all on vitamin D this morning, Brooke. Anything else quick as we wrap up you'd like to mention?
Honestly, don't write off vitamin D supplementation just yet. It's definitely worth having a conversation with your healthcare provider. If you're living in Canada, there's a good chance you're going to need supplementation at some point. So talk to your healthcare provider about how much that looks like for you.
Okay, well, thank you so much, Brooke. And lots of sunshine this week to, help take us through.
It will help during this season. Absolutely.
Okay.
Yeah.
Thanks so much. We will chat next time. Thank you.
You bet. Thanks, Chantal.